Hello and welcome back to our summer edition of Silvia's Health Hints. Again in Parco di Horticultura with behind me the view over Florence. Okay, today I would like to talk about electronic prescriptions in Italy, how it works. It's an important subject because there are a lot of English-speaking medical providers who offer telemedicine video consultations, means remote consultations, and then of course you get only a digital version of your prescription, which normally it is some kind of a PDF document. And here's the problem, that if you go with this document to the pharmacy, it can be that they say they don't accept it because they need the original prescription. So why, for example, these doctors, including myself, why we are not issuing the electronic, the e-prescription, which exists in Italy, which is a prescription where the patient gets a code, these are numbers, and with this code goes to the pharmacy, and the pharmacist, through the code, can see the patient's name and which medicine has been prescribed. It exists, and for example, I also can issue this kind of prescriptions, but this kind of prescriptions can be only issued for people who are in the Italian health system, who have the so-called tessera sanitaria, which means who are holders of the Italian public health insurance card. Because this is not a miracle, super technologic prescription that can see how often you already bought this drug and everything. It's only that it's connected through this code. The pharmacists have access to the electronic medical record of the patient, and this way he can see that this prescription has been prescribed because it's documented in the medical record, and he can also see in case of repetitive prescriptions how many times you already bought this drug. Because as I already mentioned in one of my previous videos, we have single-use and repetitive prescriptions, and we have, for example, prescriptions which can be used 10 times in a period of 6 months, prescriptions for stronger drugs which you can use 3 times in a period of 30 days, and then very strong drugs, the prescription is a single-use prescription and can be used only once. And this is the problem, that in case of foreign patients, like tourists, abroad students, but also expats which have no access to the public health system, we are not able to issue this kind of prescriptions. And this makes telemedicine, all remote consultations and prescriptions, difficult. So you need to pay attention if you use telemedicine, that you clarify with this provider, with the doctor of the provider, first of all, what kind of prescription is required for the drug you need to get, and how this provider will make sure that you will get your medicine when you go to the pharmacy. It depends a little bit on the pharmacy of the area, of the town. For example, I do telemedicine in all Italy, and it depends really on which city it is. But what is important to say, that the pharmacy has the right to deny the medicine. They can say, no, we want the original prescription. In case of single-use prescriptions, they will always deny you the medicine, because by law they need to take the prescription from you and they need to keep it. If they have a control, they need to show that they have taken this prescription. In case of the prescriptions which are valid 3 times in 30 days, it depends a little bit. It can be that it's a pharmacy you are going regularly to, they know you, so it can be that they give you the drugs. The easiest way is what they accept very often is if you have a prescription which is valid 10 times in 6 months, because these are like only antibiotics or anti-inflammatory or paracetamol, ibuprofen, things like this. So this is a little bit a problem. That's why it should be always clarified before the consultation, before you spend money for the consultation, if the drug you need can be prescribed remotely, and you need also always discuss that the provider will make sure that you, at the end, you will get your medicine, because if not, it's a waste of money, the money you spend for the consultation. So unfortunately, we don't have the possibility in Italy to issue the official electronic prescriptions for patients who are not in the public health system. And this is not only, this is also for the private prescriptions, because we have these public prescriptions. The patients don't pay or pay only a small part of the cost for the medicine. And then we have the private, the so-called white prescriptions. They both exist as electronic versions, but unfortunately only for patients who are holders of the public health insurance card of Italy. Okay, so this is all about these electronic prescriptions. I wish you a nice summer and see you next week.